Hello and welcome to Mobile Interactions Now, the podcast where industry pros share firsthand experiences on making mobile interactions work. I'm Chris, and I'm part of the team here at Tentech. On today's episode, we're joined by Lukas Lampe. Lukas is the CTO and co-founder of POM. Lukas and Gene talked about the ins and outs of the development of the POM device. So here is part one of our conversation with Lukas Lampe. Take it away, Gene.
Lukas, welcome to the show. I take special pleasure in having you on the show today. I had a rare opportunity to see an early prototype that you made, of the POM device. Ever since then, I was so curious how this is going to get to everybody who needs it. So I'm thrilled to catch up with you today. And perhaps I can get the latest. And if you are willing, even something beyond that was to come next. So first, we did a little intro in the beginning, but I am sure they will love to hear from you directly. So can you tell us a little bit about yourself and what you do at POM?
Sure. Well, first of all, thank you very much for having me on the show. We know each other for quite a while, and you have been always a very good friend. So thank you very much having me here. And yes, well, I'm Lukas Lampe. I co-founded POM. POM is a personal safety company in New York, and yeah, I'm working on it since like 6 years now. And yeah, I'm glad to be on the show.
Awesome. Now, you're too close to the subject matter and the device itself, but I consider POM as a novelty thing. So, unlike when I'm doing mobile phone, I feel like I need a little bit of a general introduction for our audience. Just explain what it is and who is it for. So can you just start from there?
Sure. POM is basically a small, discrete personal safety device. It fits on your keychain, and you can do a couple of things with it. You can call emergency dispatch. You can also just connect with your friends. So there's a couple of different ways how to get out of uncomfortable situations. And it's basically a small keychain-sized dongle connected with your smartphone via Bluetooth. It has a speaker and a microphone on it, 2 buttons, and and it has a fairly good battery life, so people can recharge it after a week or so.
So who are using it actually?
So it was designed usually for the student market. So it was basically, the idea was to replace the commonly used blue light poles in America in American campuses, college campuses. And our vision was basically to replace that system with like a modern technology, a mobile technology, so that students, if there's anything they need help with, can call into their campus safety dispatch center. Now we're branching out a little bit. We're seeing the need in other industries. So nurses are using it now, realtors are using it now, older people are using it now. Basically everybody who kind of has uncomfortable situations in their lives, or just know that there could be medical issues, etc.
Now, can you tell me a little bit more about what those typical uncomfortable situations? Because I do think that there are a lot of emergency situations, and I'm kind of wondering if it's just nice to have, or it's a real emergency communication kind of system.
Yeah, so basically it is an emergency system. So it got used, for example, at burglaries, robberies, or even medical incidents where people couldn't really get to their phone and call 911. They just needed a button to quickly call for emergency help. And then what happens is basically as soon as they press the button, it starts a phone call with the dispatching center. They get the location, and they can see on their screen some profile information like medical information, but also emergency contacts, etc. So in the end, they will have all of the information to be able to send help. And what's important as well is that they can actually talk to the victim or the person who called in, so that they can actually gain a couple more information, assess the situation to really know like what kind of help is needed here. That's basically like the main feature why a lot of people are buying it. But we've learned over time, obviously, that that feature doesn't get used a lot. Like it only gets used in a test sense a lot, that people just want to make sure it works. But then we were thinking about what kind of other use cases are actually out there more in the day-to-day life, which are uncomfortable and where we could help. And that really came down to a couple of different things. Like for students was more like when strangers are started talking to them on campus. Or when they feel like uncomfortable in certain conversations, etc. Or if they just want their friends to come and join them, for example, for a walk or on a party to get out of some uncomfortable situations. And with that in mind, we kind of like build other features around it, so that you don't only have the emergency feature available all the time. You also have, for example, what you can do is you can, when you hold down the palm, the button of the palm, you can basically text your friend your location and a predefined text, or you can just call them. Or what you can also do is you can initiate a fake phone call, which is the feature which is widely used actually, not only in emergency situations, also more in everyday life. Let's say, for example, you have an uncomfortable conversation with somebody and that somebody doesn't stop talking. Wouldn't it be cool if you just press the palm and you receive a phone call from your mom or anybody, and you obviously have to take that phone call so you get out of that situation. These features have been proven to be very practical in different situations, so that you can get out of uncomfortable situation, or sometimes even for jokes, but that's okay with us. And yeah, so in addition to that, our app also has a couple more features like virtual escort, where you can say, hey, I want to be in my dorm in like 10 minutes. And if I don't arrive, please send somebody. And we have that basically as well.
So now, it's just so many fun, but like something very, very critical features I'm hearing here. So perhaps it will be helpful if you were to just take one example, like, okay, so this user pushed this button and triggered this XYZ function, and can you just walk us through, because I have some geeky listeners as well. So once that's triggered, and then what happens from there? Tell us just the whole thing that is happening in the back room.
Yeah, sure. Well, let's say, for example, you trigger the emergency call. I think that's the biggest use case and the interesting one. It's basically, and let's say, for example, our system would be connected to the campus dispatcher. So we actually don't only have the front end kind of where you say, okay, you have the button and the mobile app working with each other. Now there's also actually dispatching software at the campus safety level, and they're running that dispatching software 24/7. So basically what would happen is if you press the button, it triggers a signal to the phone, and then the phone basically looks up your location and tries to determine where you are and if you're in the vicinity of the campus. If you're within the campus borders, which we have defined beforehand, obviously, then what would happen is the phone tells the POM, hey, call campus safety. And in addition, it says, okay, and send all the location, send it all to the dispatcher so he can actually, or she can see you, knows where you are, and also has access to your profile information. Let's say, for example, a picture, the name, obviously, a phone number, the email address, and medical information, or even emergency contacts. And then What happens is then the dispatcher sees that alert popping up. It makes a huge sound. It's always very loud. It's kind of funny when you actually go into the dispatching centers. Everybody it definitely gets your attention. And what will also happen is the phone will start to ring at the dispatcher's end. And then what happens is the dispatcher will take the phone call, sees where the student in this case is, and can talk to the student through the POM. So basically the POM acts as a headset with a speaker and a microphone. So you don't even have to have your phone out of your pocket, which is for many campus safety directors a very crucial thing, because it makes it just more viable in the practical sense. And we achieve that basically with a Bluetooth connection, which is in dual mode. And that means it's basically using a couple of different protocols, which obviously the HFP and HSP protocol, but then also the low energy Bluetooth, which kind of like holds the steady connection and also enables us to have a relatively high battery life. So you have to recharge it only every week and not every day or something like you have with the iWatch or something.
Now, I didn't realize how much of the actually built-in connectivity and usability in that tiny little device you have there. Now, in addition to what's happening on the device itself, what do you have to do, if any, for the campus itself? Are you setting up anything?
Well, it's actually all self-sustained, but if we install basically our system, it's not really an installation on their servers. Everything's cloud-based. It just runs on our servers. It's more training. So we will have an initial call, very quick, asking about what are kind of the settings they want, what are the campus parameters in regards to the geofence, what kind of phone number should we call where, and after that conversation, we set their environment up. And then what we do is just we will go on site and test and train every single dispatcher. Yeah, that's usually also very easy. We kept everything. The entire software is really built to not take up too much time and very self-explanatory. Back in the day when we actually met, that was the time where I slept literally at 911 centers and campus safety departments to see also how the night shift is actually reacting and what do they need that this system is actually viable and usable for them. I remember that the early days, it was really the question for us, like it was not only about the user who wants to do the emergency call, it's also about the ones who receives it. But that has been proven now for a couple of years to be very successful. And for other companies, let's say, for example, health systems, we do it differently because they usually don't have their campus safety office integrated there. We actually now partner with a 24/7 emergency dispatch center. They call it Rapid Response. And they take the calls. We're partnering with them now since a year, and it's been very successful. We integrate within their systems and their processes. So it's very important not only to think it technically, what you do, it's also very important to think about, okay, how can you actually integrate your system within the processes the dispatchers are used to, so that they don't have to be trained too much, and in a stress situation, they can easily get the information they needed. And yeah, so it's that we only had to do that one time. Basically, we're continuing to innovate and obviously update the system, but that has been also very effective so far.
Now, that sounds like an elaborate setup, if you ask me, because there are many different parties involved. And I think the whole workflow that has to happen, because there's no room for error. But I'm wondering, from the very buying process part of this, What are some of your typical champions within organizations who are try to bring your solution into their campus and their work environment?
Well, that's a very, very interesting question, and that's the hard part, I would almost say, as a technology guy. It was always, I don't want to say straightforward, but it was always doable to build the system. And you mentioned the redundancy you need to make it actually, like a security system. And that has been easy. But like on the other side, obviously the sales part, the question really is like, who do you target? We started targeting colleges at the very beginning. And there it's really the director of safety, the VP of student affairs, everybody who basically thinks about student affairs. And those are the people we're targeting. But in the end, it's a very interesting buying process because, well, in the end, you need the approval from the board and the president. So it's sometimes hard for people like the director of safety to actually go to the president and then want to have fun for that. And some colleges were able to do that. Some colleges were still stuck in the buying process. We have yet to hear a lot of colleges who say this is a bad idea. It's just, it takes time. Colleges are like big ships. They're not moving fast. They want to make sure this is working, etc. Yeah, it's been very good. On the healthcare side, though, we're seeing now a lot of interest specifically in their mobile workers. So home health, for example, is a huge part where we're growing very quickly. We implemented it on a couple of different health systems yet, and currently are also in a lot of pilots. And there it's usually the COO, the chief nursing officer. Sometimes health systems also have a director of safety and security. And what we've seen here is, I mean, they have very good answers for their in-hospital safety on campus. Like they have cameras, access systems, all that stuff. And these are sophisticated markets with few players. But we were at a conference in Florida, and we asked a simple question: what do you do for your mobile workforce? You know, do you have anything here, and any safety solutions, any security solutions? And we haven't heard a lot like that. There's anything. Many people just say, "Well, we train them. We have a nice process and stuff." And then we asked, "Okay, what happens if you really need help, or what happens if it's just an uncomfortable situation?" I give an example. It was fairly interesting. We heard a nurse got literally stuck into the room of a patient, and the patient said, "You get out of this room if you listen to my piano music." So she was stuck in a room an hour. She didn't get assaulted. There was nothing happening, like on a physical sense at least. But it was a very uncomfortable situation. Wouldn't it be nice if you get a phone call in that moment? Or if you just discreetly text somebody, "Please come here." And then that somebody could be another nurse, etc., but comes and just that there's somebody else in the room and helps you out of it. And it's not even that you need the police necessarily, you know what I mean? You just need to get out of there. And that is what we hear that a lot, like these kind of little things where people feel uncomfortable seeing it as part of their job, which I think, honestly, it's my sister's a nurse, you know, like for me, it's incredible what kind of work they do, but I think kind of the world gets a little out of hand in that sense that nurses have to actually deal with all that stuff. So with that in mind, in the health systems, we talk to a director of security, we're talking to CNOs, chief nursing officers, we're talking to nurse managers, and we work with them to also specifically also make that system even better for them. So that's also something we're trying to do, is continuously improving the system. We released this year alone like 3 bigger features specifically for healthcare, and they have already been proven like being very effective.
That is really interesting, because although this is an enterprise use case, the minute you hear healthcare, I'm thinking about the patient end of it, a home nursing situation, and I didn't think about the people, the actual professionals who have to actually go to, sometimes for the first time, like strangers' house to take care of them. And that is totally different way to look at it.
You mentioned it at the beginning. You think it's a novelty, and I think it's still a novelty. Personal safety in that sense is still a new market. There's a lot of players now who trying to go in there with a new technology, which happens over the last couple years. And they also get more and more sophisticated, like Bluetooth, for example. Low energy Bluetooth gets more and more sophisticated over the years. It's still a new market, and although everybody knows Life Alert for elderly, so you mentioned that in one of our conversations before. But really, what happens to people in their everyday lives or everything, they should also be able to use the current technology. And we're still learning in that market. So we're seeing a lot of players. We're seeing a lot of players with same kind of features. But I still think that there's a lot to be learned and a lot of education to be done. So that's the other part, is that because it's a novelty, if you create a new market and you have the vision as a co-founder, hey, everybody should have access to emergency help anytime. There's a lot more to it than just building the product and throwing it at nurses or students to say, okay, use it. You have now emergency access. No, it's way more, and to actually make it successful. And that's, for us, it's really data, and conversations with our users.
Let me pick that up a little bit, because you talked about learning from the users and really talking with them and watching them. And you bring it over and you try to build that into the product you're doing it. But I also know there are many people who are developing products. They have this moment of like, being pleasantly surprised, because oftentimes users find their own way to use things that somebody, when you are designing the product, that you never thought of. Is there anything that really surprised you in terms of how your users are using it?
There's a couple of things. One of the biggest thing was actually the fake phone call, as I personally was not a big fan of it at the beginning when that idea came up, but it was relatively easy to implement. So I was like, all right, let's just do it and try it. And then it became one of the most used features, which was, which is funny, specifically on a student campus, it was funny. On the other side, what we've seen is, for example, on the text message side, it's so if you press the button, you can text a friend. We've seen developing, like on a couple of campuses, we saw people say oh, we are POM buddies now. So I was on campus giving out the POMs, and then two girls came to me, yeah, we're POM buddies. We put each other as an emergency. We're fine. And then the other one came, and the other one, and I'm like, oh wow, that's cool. And now we're actually taking that concept, and we will integrate it into a more sophisticated feature, which will come out in the next couple of months. And then the other way was the emergency feature was actually used as a escort feature. So people called in and they just said, can you be with me 5 minutes on the phone? Just be with me on the phone. I'm walking you through. I don't care about the walking. I want you on the phone. Do you see me? Do you see my location? I'm here, and it's dark and cold, and it's uncomfortable. I want you to be on the phone. And obviously then our call center, or in that case, it was actually the campus safety officer stayed on the phone and made sure that she arrived safely.
I don't know how I got to this question from what you just said, but what you just said got me curious about your pricing model. How is this? Is it usage based, and how are you pricing this?
So because we have to man emergency dispatch center, it's a subscription model. So we usually charge for the device, and then we charge on the subscription side if somebody chooses to use their own dispatch center, which obviously most of the colleges have. Then it's still a subscription because we want to make sure that we develop the product, we add features and all that stuff. So for us, it's not a one-time thing and just want to sell the product and that's it. We really want to have that subscription just because we want to go with the time and make sure that you always use the latest and greatest technology, and that we can make sure that we improve the product to be more valuable for you. And that's really if you're in the price trend as a B2B or as a business or as a consumer, you stay at that price. But we really want to make sure that in this early market we can improve the product.
Sounds fun. And I heard about a little bit about your customizable command center, and I'm curious what that feels like, because I'm immediately imagining some kind of really like emergency system, little virtual bunker like situation. So tell me what that is and how customizable it can be.
Well, there's a lot of stuff. I mean, so basically it's all about setting it up how you want it to work. So who should it call? What kind of emergency protocol do you want to happen? So, you can really say, okay, as a company, any call who comes in from our nurses, for example, should notify these people, should or notify even like not only email and text message, also a call actually. It should actually trigger these actions. It should either always send an ambulance or always send police or always send firefighters. Here are the things which happen if you can't get in touch or you can't, if the person can't talk. So that's the one customized. Then you can also customize and preset the auto text, the auto call, or the fake phone call. So really like go really deep in there, and then you can add features. So we have a couple of features for the mobile workforce, for example, in the health system. There was the scheduling feature where you can put in your schedule, and then we enable more sophisticated location, because we know you have an appointment in apartment 3C on the 7th floor. So we can send that additional information over to the dispatcher, which is specifically, as you know, in New York, could be an issue, because the question is where are you actually in a building, and if you have like 30 floors, that could take a while to find that person. Then there's other things like mass broadcasting. Who should be able to mass broadcast? Who shouldn't be able to mass broadcast? And we're working actually now on other features. Availability dashboard, we call it. It's basically a dashboard where you can see your workforce mobile and kind of like see what kind of schedule they have and kind of even contact them fairly easily and manage them on the fly. Those are still features we're working on, but that will all be customizable for our customer.
This is what I love about software-based products. It's just limitless. I mean, it's like you are only limited by your own imagination. So I think it will be amiss if we don't address this, because it's the user privacy, the data protection, all these things, because you do have a sensitive location data and all those things. Take us into some of the issues that you have to deal with.
Well, yeah, we on the business side, on the enterprise side, we definitely have to go through rigorous IT like questions and kind of like they are looking at our system, and we basically have all the standards you need, on the technology side to be safe. We're using all the standards protocols, the secure protocols. We're encrypting everything. So in that sense, it's usually a quick conversation, honestly, because we designed the system to be secure, and we are very sensitive about it. We also don't track somebody the entire time, specifically not in the consumer space. That is something I'm very personally, I have a very big opinion about it, because I really want that people are autonomous, or really know if they get tracked, but they're also safe. Like, I don't want to build Big Brother everywhere. That's not what I've ever intended. But I want to give people access to emergency help, but still, like, if it's needed that they have to be tracked in the enterprise world, then it will be very obvious to the user that location actually went through. And that's very important for us. We don't do nothing in the back door there. Everything is very transparent. And that's very important to me. And on the data privacy side, all the standards, I mean, we can go through them, but I don't think they're very exciting for people. But that's basically it. Yeah, we have also outside companies who look at that.
Thank you again to Lukas Lampe for joining us today. Don't forget to tune in to our next episode for the conclusion of our conversation with Lukas. You can find out more about Lukas and POM at getthepom.com. To find out more about Gene and Tentech, visit tentech.com. Make sure to search for Mobile Interactions Now in Apple Podcasts, Google Play, Stitcher, or anywhere else podcasts are found, and click subscribe so you don't miss any future episodes. On behalf of the team here at Tentech, thanks for listening.